Chidiebere Ibe, currently a medical student at the Copperbelt University School of Medicine, and also a medical illustrator. So currently I hold several positions. I currently serve as the chief illustrator at the International Center of Genetic Diseases at Harvard Medical School, and also serve as the chief illustrator at the Journal of Global Neurosurgery, and also the lead illustrator at Illustrate Change, which is a project pioneered by the Johnson & Johnsons and the Deloitte. I'm passionate about representing Black people in medical literature and portraying areas in medicine that have been ignored in terms of portraying skin conditions that do not represent Black people, and also portraying areas in medicine that some sort of cliches or some sort of mentality towards that these diseases don't happen among Black people. So basically my work is to incorporate art and medicine together to communicate the message of diversity and inclusion, and hopefully improving healthcare outcome for everyone. That was during the lockdown where I met my mentor, Dr. Ulrich Sidney. I reached out to him. I wanted to work for him, for the organization as a graphic designer. So he said there was no money to pay, but I said, okay, I wanted to be my mentor, because I was passionate about medicine then, and I wasn't a medical student then. So, but then I was also an artist, so making art with pencil and pen. So then he saw my artwork and said, why not go into medical illustrations? Because you have passion for art and for medicine. So I decided to just, okay, it sounded interesting. So I started making research about illustration, what it takes to be an illustrator. And I realized that I was a bit disadvantaged because I didn't have the resources or the knowledge to learning how to be an illustrator. So everything I learned was self-taught. So how to teach myself the software used for illustration, how to teach myself anatomy, and literally push myself to this point. But in the journey of learning illustrations or teaching myself illustrations, then I realized that there was so much of underrepresentation of Black people over the internet and their medical textbook. So I decided to see, how can I solve this problem? How can I, change the perception of people with illustration? So I started creating more Black illustrations, and on and on. It has been a rewarding journey, I would say. In my opinion and in my work, it's really a critical issue for patient safety, because when you talk about cases of misdiagnosis, right, we've had cases where patients are misdiagnosed, right, because of lack of representation or because of lack of accurate representation. Some time ago, there was an interview that was carried out in Nigeria. Most medical students were asked, what does H rash look like on the Black skin? And they said it looked reddish on the Black skin. That was a wrong representation, because it doesn't look red on the Black skin, because of course the whiteness is not there to see the redness. But because the resources that medical students are used to training medical students are all resources that are white centered. So medical students are actually trained to misdiagnose skin conditions, and also it has also led to delayed diagnosis. I had a time where a patient shared with me that that she had skin ulcer, but when she went to a dermatologist said that Black people don't have skin ulcer. And then because of the lack of knowledge, treatment was delayed and the health outcome became worse, and the case became more aggravating than it should have been. So this is because of lack of representation. Because if this was accurately represented, most medical students who become doctors would have the basic knowledge of how to diagnose this simple skin condition. And also one thing I would say is the lack of understanding of risk factor that cause certain diseases, or that cause, like, for example, cancer, for example. Today, I created a piece on prostate cancer, and one of the risk factors for prostate cancer is race, right? So 1 in every 4 male will have prostate cancer, but yet we can't understand why the statistics is there, why when a Black male would have prostate cancer. And because of lack of representation, we don't have this, and because of lack of involvement in clinical trials, we don't have this basic knowledge. and of why this thing happened among Black people. So, in my opinion, this is certain things that can be critical factors to patient safety. I've been blessed to have several roles and working with several people. But I would say, in terms of what's more fulfilling for me, is I would say one of my roles also is taking time to read through the comments. So I go through the comments and I read through, people sharing their own experiences, people sharing how my artwork have changed their life and how they feel seen and heard. For me, that's the most rewarding part of my work. And in as much as I've had the opportunity to work with a lot of great people, but I think the feedback I get from people is the most rewarding part of my role as an illustrator or my role as an advocate or as someone who is passionate about representation. So I'm just always excited when I get to read comments and get to hear people feedback about the kind of work that I do. For me, I would say one of the big challenge is the stereotype and the bias, right, in healthcare space, right? Because we are in a system where if healthcare outcome, for example, improve generally, but not for certain population, then there is healthcare disparity or there's healthcare bias or there is the stereotypical approach towards healthcare for that population. And that population is at risk. And of course, you wouldn't say the safety for the patient there. So in my opinion, one of the major things, is the bias and stereotype. Some time ago, I read a research that says, that Black people have nerve endings that are less sensitive, which simply means they have high tolerance for pain. So, where cases where Black pregnant women go to, hospital and complain about pain, and the doctor said, you're a Black woman, you should have high tolerance for pain because the nerve endings are less sensitive. The patient is at risk. And that is because of bias, that's because of, stereotypes that has been transferred from, generation to generation and from system to system, and this has affected patient safety. So if we can simply address how we perceive certain population, that would go a long way in improving patient safety for certain population and possibly for all population. In my opinion, there is just few things that can be done because the idea behind bias or stereotypes that affect patient safety, it is the idea about information, right? Because if someone, as a child growing up and a child is being taught about, healthcare, and the child is being introduced to certain cliches around certain population, right? For example, I have a child and I'm training my child, and I told my child, okay, remember that all Black children or all Black kids, right, have less sensitive nerve ending or they don't feel pain. That is an information, and the child will grow up with that information. And the only way to change that information is to bring a superior information. So, in my opinion, the only way to addressing this, in as much as research is important, clinical trials is important, it's important to have a system that educate people about the reality of these facts, right? So when I created my piece on the Black fetus illustration, people started realizing that this is something they have been missing for years now. They haven't understand that we didn't realize that there's something missing in healthcare, which is bias in healthcare. So people started talking about it, and that's one thing about my work. It has been able to shape difficult conversation. People were scared about talking about bias, talking about stereotypes, scared of being called out as as an activist or as an advocate or something. But now, because of the information out there, people are now bold enough to share their own story. People are now bold enough to talk about issues like this, bias in healthcare. And I strongly believe that with accurate information, teaching people, integrating this into the curricula in the school system, allowing students to understand that this is a pandemic in quotes eating up our system, then we can say we are slowly addressing the bias in healthcare and ultimately, improving safety for our patients. tough question, right? But I think if I could do that, I would simply change people's perception towards particular population. Because if I change my mindset towards a particular population, the way I treat them, the way I regard them will be different. It has been proven by research that healthy outcome can improve if the physician looked more like the patient. That patient felt more confident, right, if that physician looked like them. Right, that's to say that there will be an improved outcome if we change the mindset, change our mindset towards certain population, and we treat everyone fairly and equally. And I believe this is where all of this starts. One thing I would say that I do outside of my work is having meaningful conversation with people. Over time, I understand that people have a lot to share, but sometimes they don't have someone to listen to what they have to share. So in as much as I'm always the one on the side of speaking about my experience or my work, I would just love listening to people talk about their own knowledge about patient safety and their own experience. And altogether, I would say this has also um, supported my work, sort of, because when I listen to them, I learn from them too, and that also supports, in the kind of work that I do. So outside my role as an illustrator or as a speaker, as an advocate, I just love listening to people, to patients, listening to other my fellow speakers, sharing their own knowledge, and I think with that alone, it can be, it can be like a support system, I would say, for me, or like a learning curve for me, part of my learning curve for me, which can also help, in patient safety. I know I've done a lot of interviews like this, and I've said a lot of things that I haven't said before. Well, I don't know if I've mentioned this before. Um, I have a very powerful intuition. Sometimes I get to know things and I don't know how I know them. I don't know if you understand. Sometimes, people ask me questions that I've never heard before, but I just have the answers to the questions, and sometimes I wonder, okay, how do you do that? And I still don't have an answer to that yet, how that happens.